If the root cause of your low back pain, hip pain, knee pain, or ankle pain is coming from the foot and ankle, then doing these exercises will help tremendously at alleviating your symptoms of low back pain, hip pain, knee pain, and ankle pain. So go ahead, give those exercises a shot. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be teaching you how to be your own therapist by demonstrating 3 exercises to help you treat your low back pain, hip pain, knee pain, and ankle pain. When a patient comes to me presenting with low back pain, more often than not, it's going to be due to some type of dysfunction in the lumbopelvifemoral complex. I've already discussed this in detail in another video called 10 Years of Low Back Pain and Sciatica Gone. I'm going to include a link right up over here if you haven't seen that video, but what do you do if the root cause of the problem is not due to dysfunction in the lumbopelvifemoral complex? Well, one of the next most common problems is going to be due to some type of dysfunction in the foot and ankle mechanics. A lot of patients that come to me, they are going to present with an overpronated foot or a flat foot. When you have a flat foot, this is going to trickle up the body and it could lead to a host of issues, because when you do have an overpronated foot, what's going to happen is you're going to develop a valgus ankle. A valgus ankle is a lateral force, so your ankle is going to move toward the midline. When that happens, that is going to be coupled with external rotation of the tibia, meaning your tibia or your big shin bone is going to be rotated outside. Then what's going to happen from there is you are going to develop a valgus force at the knees. The knees, if it gets really severe, you could think of this as the knock knee position, but basically your patellas or your knees, they are going to move toward the midline once again. This is going to be coupled with medial rotation of the femur or your thigh bones moving in toward the inside, which is going to be coupled with anteversion of the pelvis or an anterior pelvic tilt. So your pelvis is going to be tilted forward. When you end up getting an anteversion of the pelvis or an anterior pelvic tilt, what's going to happen is you are going to develop some lengthening of the hamstrings, and this is going to cause your hamstrings to become taut. A lot of people are going to confuse this tautness for tightness, but I made a video on this as well, and this was called Stop Stretching Your Hamstrings. I'm going to include a link right up over here. But aside from developing taut hamstrings, you are also going to develop shortened hip flexors. Specifically, your psoas major and your rectus femoris are going to become in a shortened position. From there, this is also going to lead up to the glutes. You are going to develop a lengthening of the gluteus maximus. You are also going to develop a lengthening of the rectus abdominis. And lastly, you are going to have shortening of the lumbar erectors. Now, in order to address all of these issues, what we could do is take a look at the foot and ankle and develop some exercises to help strengthen the arch, bring your foot back into more of a neutral position. And if the root cause of your low back pain, hip pain, knee pain, and ankle pain is in fact coming from your foot and ankle, these 3 exercises will help tremendously at alleviating your symptoms of low back pain, hip pain, knee pain, and ankle pain. Now, the 3 exercises that I'm going to be demonstrating for you today are going to be the foot and ankle point, flex, and curl, the towel curl, and the toe curl. For the foot and ankle point, flex, and curl, you are essentially doing this motion with your foot. What you want to do, let's say that my wrist is my ankle joint and then my fingers are my toes. You want to plantar flex your toes, so you're going to point your ankle down toward the floor. Then you are going to flex your toes, so you're going to curl your toes down toward the floor. And then you are going to drag and curl your foot and toes. So what you want to do is start to go into dorsiflexion and then extension of the toes. So you are plantar flexing, going into toe flexion, then you are going to go into dorsiflexion, and finally extension of the big toe and the rest of the toes as well. That is the foot and ankle point and flex and curl. The second exercise is going to be the towel curl. Once you've built up a little bit of strength and stability in your foot, then you want to work on the ankle a little bit more, and this is going to be a little bit more challenging. What you can do is lay a towel out on the floor, and with your foot, what you want to do is just curl the towel toward your heel. This one right over here, when performing this exercise, you want to make sure that you are doing it on a surface that is nice and smooth. You don't want to be doing it on something like carpet or on gym flooring, because you're not going to be able to get a good grip of the towel. You would be much better off doing it on something like either hardwood floor, laminate floor, or even something like a ceramic floor, but definitely stay away from carpet. And then lastly, the third exercise is going to be the toe curl. This one right over here, it is a progression to the towel curl. What you can do is tie a very light weight, something like even a key to a string. You are going to toss the string out to the side, and then with your toes, each individual toe, you are going to place the string underneath the toe and try to drag the key or the weight toward your foot. Once you end up finishing with the big toe, you're going to throw the key far away, and then you're going to do the same thing with the second toe. You're going to curl it toward you, throw it away. You're going to do the same thing with the third toe, and you want to do this with each one of the individual toes. That way you can develop the proprioception in each of the individual toes. Now, with regard to this one right over here, this one, a lot of people are going to really struggle with this one. So you want to do the first two exercises first, and then this one would be the finisher. But with this exercise right over here, the big toe, even the second toe, you're not really going to have too many problems once you've gone through the progressions. But once you start getting toward the third, fourth, and fifth toe, that's where you're going to start to see that you're going to have a lot of problems and that they're going to be very, very weak. But go ahead and give those exercises a try. And if the root cause of your low back pain, hip pain, knee pain, or ankle pain is coming from the foot and ankle, then doing these exercises will help tremendously at alleviating your symptoms of low back pain, hip pain, knee pain, and ankle pain. So go ahead, give those exercises a shot. If you do give them a shot, then drop your comments down in the comment section with your experience, or if you have any questions, go ahead and ask your questions down in the comment section, because I would love to hear your guys' thoughts. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.